Diastasis recti is where the two halves of the rectus abdominis muscle, which is the six-pack muscle in the front of the tummy, where those two halves are separated. And that's usually because of pregnancy, sometimes because of weight gain. It's like a seam, and it can stretch like, almost like if you take a bit of blue tack and you pull it and stretch it out. In the majority of women post-pregnancy, with the right exercise, the rectus abdominis muscles can kind of come together again, and you can have that compensated and even reversed. But sometimes it just doesn't happen, and no amount of exercise, no amount of physiotherapy, no amount of trying will ever get them back together again. In that situation, you need surgery where the muscles are brought together again. We don't actually stitch the muscles, we stitch the membrane that covers the muscles, and that also forms that seam that sits between the muscles. So we kind of zip them up again. And that should fix the problem. After surgery, they then need to work on their core, exercise the muscles that have become weakened inevitably because of that gap, exercise them, and that helps to tighten them up and helps to flatten the overall appearance.